Okay, good morning, good afternoon, everyone. Thanks once again for joining today's webinar on preparing the EMR region for HSR 2026 in Dubai. We know it's a busy month with the holidays, closing of project, grading, etc. So thank you for making the time. And my name is Racha Fadlallah. I'm a board member of Health System Global Society, or HSG, representing the Eastern Mediterranean region. I also co-chair HSG EMR Network. I am based at the American University of Beirut in Lebanon. I am joined by Fadi El-Jardali, who is a professor of health policy and system and the founding director of K2P Center, which is co-hosting HSR 2026. Fadi has previously served as a board member of HSG, and he is currently leading the scientific program for HSR 2026. We are also joined by Goran Zangana, who is the board treasurer, and he also represents the Europe region. So thank you, Goran, for making the time to join. I know it's busy at your end, so we appreciate that. And we will also have an intervention from HSG Secretariat, A.M. McLean, on the abstract submission tracks. So without further ado, we will proceed with today's webinar. So just to give you a sense, so the webinar is divided into two segments. In segment one, we will focus on understanding HSR 2026, specifically delving into the theme and subthemes, the abstract submission tracks, and the key dates and timeline to keep in mind. In segment two, it's more about the abstract development. So we will provide tips on how to strengthen your abstract. We will share EMR illustrative framings / diagnostic checklist corresponding to each of the sub-theme, which can serve as a stress test to see to what extent your abstract fit HSR 2026. And certainly we will have space for you to reflect and share emerging ideas you have for abstracts related to HSR 2026. So before I start, I just want to give a brief introduction of who we are. So for those of you who are not familiar with Health System Global, so we are a global society that connects and engages researchers, policymakers, healthcare providers, and civil society from around the world to advance the field of health policy and systems research, and certainly to contribute to health system strengthening around the world. We are a strong community with global presence, so our membership expands to over 1,800, crossing all 6 WHO regions. And our members, they have the opportunity to get involved and contribute to health policy and systems research through three main streams. We have the thematic working groups, which constitute 10 thematic areas reflecting different dimensions of health system, from climate resilient to conflict to anti-corruption, etc. And we also have the regional networks corresponding to each of the 6 WHO regions, and the Eastern Mediterranean Network is hosting today's webinar alongside K2P Center. And the third most important stream is the Global Symposium on Health Systems Research. So every 2 years, we organize the largest global symposium on health system research in different parts of the world. We started in 2010 in Montreal and then moved on to Cape Town, Vancouver, Liverpool, Bogota, and the most recent was held in Japan in 2024. So what happens at this symposium? There is really everything for everyone. So whether you want to be inspired by the big future thinking, you can join the plenary sessions, which have high-level discussions with high-level profile people and leading voices in the field. If you want to learn or remain up to date with the latest development, innovations, and methods in the field of health policy and system, you can join the scientific sessions. If you want to build your capacity, you can join our workshop. If you want to network and connect, maybe your priority is networking, you can join many of the networking corner that we create to foster lasting professional connection. You can also walk around the poster and exhibition areas to engage with many of the innovative and cutting edge research. So there is really everything that one ideally would find in such a global symposium. And why is this important? First, because of its global reach. So, as I mentioned, we have participants from over 100 countries coming to that global event. And more importantly, it's a cross-sectoral collaboration. So it's not only a researcher event. We have researchers, policymakers, practitioners, funders, NGOs coming from around the world to attend the event. And it also leads to real world impact. So many of the evidence and dialogue really shape national and global health policy. Even the theme and sub-themes, they shape the trajectory of health policy and systems research for the next upcoming 2 years. And if you look to the graph in the right, we have participation from different parts of the world. And this graph represents the different WHO region. But unfortunately, if you look at the Middle East and North Africa region, it is the least represented region. And this has been the trend for the past maybe 3 or 4 consecutive symposia. So yes, participation from our region has been increasing, but we are still relatively the lowest participation, maybe constituting less than 5% of participants. So that's why, on behalf of HSG Board, we are really pleased that the Eastern Mediterranean region will be hosting our upcoming global symposium. And the winning bid was put forward by the Knowledge to Policy Center at the American University of Beirut and the Mohammed bin Rashid School of Government in Dubai. This landmark event will take place in Dubai, UAE, in November 9 to 11, 2026. And as I mentioned, it's important for our region because it's considered the largest global gathering on health system research. It's coming for the first time to our region. And this is a region where many of our priorities and challenges are health system related, yet health system and health policy and system research, it's still underfunded, undervalued, underappreciated. So it's a strategic opportunity for the EMR to elevate region-specific health system research, to build cross-country and multi-stakeholder collaboration and capacity around health policy and systems research, and importantly, to influence the global health system discourse and ensure strong EMR presentation in that global event. So without further ado, I would now handle the first segment to Fadi El-Jardali, where he will delve into the theme and sub-themes of HSR 2026. Fadi, the floor is yours.
Thank you. Thank you, Rasha. Welcome, everyone. I'm so delighted actually to see again many of you. Okay, we had really the opportunity before to know each other or maybe collaborate. So I've seen some good colleagues here on the call and the diversity, as Rasha mentioned. Now, my understanding, Rasha, that we have more than 100 registrants for this webinar. So maybe if the secretariat can send a more of a reminder to people, maybe they missed it or something. But I'm sure there were more than 100 registrants, and we don't have now except 27 on the call. So maybe if they can send a note, although we are actually recording it, but I think it would be good for some people to actually join, even if late. So thank you. I think this is a very good introduction about the health system global society and also the work that has been done. Mind you, also for everyone that you should know, by 20 in issues. HSR 2020 was supposed to be in the region, but unfortunately we were hit by COVID-19 at that time, and turned out really to be virtual. But this is really one of the very important opportunities, and why it is important and strategic for the Eastern Mediterranean region. Because as you know, I think all of you now know that most of the countries in the EMR now are actually going through transformation, from different visions to actual transformation that is really taking place. And to be honest with you, I've visited most of the countries, the EMR, over the last several months, and I can tell you that most of what is really happening now is actually at the core of health system research. And this is an area that is very, very important. So this is a great opportunity for health system and policy researchers in the region now, among others, and among other stakeholders, to come and see how this actually can come to bear and support all the great work that is taking place in the region, but also how to document the learning that is taking place in many countries in the region, actually, and to bring it to a symposium like the HSR 2026. So this is a very important thing, because this is where you are actually making to contribute. I think there's a lot of things that are coming now from the national level, regional level, that should be also shared at the global level. And as Rasha mentioned, this is a global symposium that bring all the regions, and this is one of the highest profile symposium in health policy and system research, bringing all people from not only researchers, but policymakers, political actors, but also civil society groups, private sectors, and others. And this is really the platform. This is the happening. This is where things happen. This is where things get negotiated. This is where things get funded. This is where things get debated. This is where innovations come. So that's why I just wanted to actually reinforce what Rasha mentioned, why it is strategic for our region. Now, let me go and I will open the discussion. I would like to hear from all of you. I think it would be good if you have any questions or thoughts or so. We're starting that conversation. But just wanted to know that we wanted really a theme and theme that resonate, relate, I would say, to what's happening in the region, but also intersect with what's happening globally. So that's why what you see in the theme at theme that we went through extensive consultation at the global level, at the region level, at the country level in the region, from different actors, but also from the health system research community, from health system global society members that provide also excellent feedback. So we ended up with the theme and sub-theme. Can you go to next slide, please, Rasha? So if you look at the theme, this is about future-focused health system. Now, as you know, we have been living in a world that really, I think the main constant factor is change. And more than that, in fact, over the last 1 or 2 years, we're living is really on, the level of uncertainty that actually is taking place now in the world is unprecedented, unmatchable, honestly, to all the eras that we pass through, which means that we need to really start thinking about the future, how we can build those future-focused health system, what that means. بالعربي هي نظم صحية مستقبلية في عالم متغير. So that's why you will see that we have been witnessing a lot of disruptions over the last. Actually, what's happening in many countries in the region are disruption, but actually creative disruption. So you see the transformation taking place. I can give you an example from many countries in the region that a lot of interesting innovation disruption taking place. But also, unfortunately, we have a destructive disruption that is really more from armed conflict to climate change, but also to digital transformation, which we're seeing really the benefits of it, pandemic and other geopolitical landscapes. So that's why we wanted to focus on the future focus transformation. That is really the essential response, meaning the usual way of doing things, the usual way of governing health system, the usual way of financing health system, the usual way of delivering health services are really changing. So what that means that this symposium is actually providing solutions. So we want to focus on solution-oriented engagement with the different type of reform, the strategic shifts that is taking place, but also make sure that we are building equitable, inclusive, resilient, and responsive and trusted health system. Unfortunately, there is a lot of challenges that the health system has faced over the last many years, including the stress test that was COVID-19. So that's why it's very critical that we focus on the future. More importantly, as you know, now in the next few years, this is where the post SDG will be negotiated. So as a health system and policy researchers, you need to have a say here. You need to shape that narrative. You need to actually think about how the post SDG era would look like, and future global initiative, architecture, frameworks all remain uncertain. So that's why we believe HSR 2026 will provide you the space to reflect on all those unfinished agendas, the learning that we have had, but also how we can really bring a collective approach of how we're looking at the vision and how we see this changing world, how the change will bring opportunities to improve, to scale up, to level up health system rooted in solidarity, social justice, and also changes from a different level. As you know, global health architecture is also changing now significantly. With it come with the funding cuts and all this, a lot of the whole global order is actually changing. All this has an implication on health system, and it's a great opportunity for researchers to come and actually ask those interesting questions. Next slide. So if you look at the theme, so again we look at the we're calling for system transformation. So this is really about this. So this is the overarching one: inclusive knowledge decision making, multi-sectoral partnership and action, effective innovative approaches to bridge governance practice innovation, research that address unfinished agendas in the post SDG, deliberation to advance equity, social justice, systematic reform. But all this focus on the future focused health system. So what we want submission that can challenge assumption, that can provide some much more reflection of where the system is going, surface power, but also help us reimagine how health system will look like. I know some content in the region now, they want to change even the word health system to become wellness system. So they are moving too much into prevention promotion, which is fantastic, which is really have a major implication on financing, on delivery, on governance, on laws, on regulations, etc., etc. AI also has been really quite disruptive so far, but how we are leveraging that, how we are taking this in a direction that. So again, there's a lot of things that we want to actually cover in this symposium. Next slide, Rasha, please. So again, the four sub-themes, yeah, if you go, yeah. So the four sub-themes, again, you can see it in Arabic and in English. We wanted to have an inclusive one. Yes, it's a future-focused health system in a changing world, but we want to make sure that we have a narrative, is a common thread across all the sub-themes. I know the work we do at the health system policy researchers is really, encompass many areas. So that's why what you see, and this is what we've got from the consultation, where one of the sub-themes will be focusing on politics and polycrisis, meaning governance, financing, diplomacy in the face of conflict and changing a global order. You can see now there is a lot of also, I would say, emphasis on health diplomacy, of how really actually to make an impact, how to engage with political forces, and how to use health as a stepping stone to actually bring change. Plurality and partnership. So how we have a diverse actors. We have even new actors now in the health system that we haven't thought about before. We have new sectors. We have different care modalities that is being introduced with different, including with the AI and others. So what that means in terms of plurality, in terms of partnership, we have one of the sub-themes on platforms and participation. So how we are harnessing, how we are really leveraging on digital technologies and honoring social contracts, and also the last one on the human ecological concern that is really related to the planet and the general pathway. So basically, how we want to bring that narrative when it comes to framing performance in a post-sustainable development goal era, which is really I think is very important. So بالعربي السياسة والأزمات المتعددة، التعددية، الشراكات، المنصات والمشاركة والمسارات والجنرال I would say planet كوكب when it comes to how we look at it, including of course humanitarian, but also environmental issues, climate issues, among others. Next slide. So again, the first one, I don't wanna again for the sake of time, but I want to make sure that you are clear in terms of what we're presenting to you now, how your abstract, how your thinking would fit here. So this sub-theme will examine how health system are governed, financed, and engage with multiple, or at least face with multiple overlapping crises. I think we have. Unfortunately, we are one of the regions that we have really, a term of the countries that are really in conflict or emerging from war. So it's really significant. So here we talk about war, armed conflict, displacement, economic shocks, pandemic, geopolitical instability. All this really, looked at it more of this, the political nature of the decision that is being taken, how power, leadership, trust institutions are founded, but also are shaping how we are making decisions, priority setting, resources. So basically, we are asking here people, when you start thinking about if you are interested now to apply for this sub-theme, I think you need to ask yourself, how do health systems govern and finance care amid conflict, displacement, economic shocks? And I've seen a lot of things emerging work and research taking place on that. How do politics, power, and interest shape health system reform? We have a lot of examples from our region. What governance arrangements supports equity, resilience, public trust under pressure? Also, we have significant work being done in the region, and how do global regional politics affect national health system? So we're looking what would fit anything that you are doing related to governance, leadership, under crisis, conflict, instability, health financing, priority setting, resources, decision making during uncertainty, political pressure, even case studies about political economy of health, about health diplomacy, about bilateral, multilateral engagement, all what I mentioned fits very well under this subtheme. So keep this in mind while you are thinking about submission. Of course, in this subtheme, we're not looking for a clinical emergency response, single crisis description with no governance analysis. These are basic, whatever. But I think what we put in the top of it, intent what fits well, is really reflect and align with the first subtheme. Of course, we're happy to respond to your question later on. Can we go to the next slide, please? So this is for subtheme 1. Let's go to subtheme 2, plurality and partnership. Again, as you all know now, there's no one sector or one actor that is really shaping health system and governing health system anymore. There's a pluralistic nature. In some countries, we have seen, a pluralistic nature, but we have seen also fragmentation. Some other countries, we've seen cohesion, coordination, stewardship. So this subthemes focus on the nature of health system when it comes to plurality, involving public-private sector, civil society, communities, informal providers, and complementary care actors, and actors beyond health. I've seen a lot of countries in the region, including in the GCC countries, fantastic work taking place about how you're engaging with other sectors when it comes to this. And to what extent this is research, I think this is very important. But this subtheme explore how partnership and multi-sectoral action can strengthen system, but if poorly governed, it can create fragmentation, inequity. And this is exactly, unfortunately, the lessons that we've learned from COVID-19 when it comes to this. So what some of the key questions here we're asking, how do different actors interact within health system? There's a lot of case studies that you can bring and put it in an abstract. What governance models support effective partnership? When we bring different partners together, how they will be governed? How can health system engage community, civil society, and other non-conventional actors meaningfully? Lot of communities, civil society groups are actually engaged at the level of community, at the level of service provision. How we are bringing them, forward, engaging them, but also governing them. How can complementary care modalities be governed and integrated within the health system? How can multi-sectoral action be institutionalized? Because in the COVID-19, there are many countries that have done multi-sectoral action, but unfortunately it was ad hoc. It was not sustainable. It was not institutionalized. كيف فينا نمأسسها? This is in Arabic. And how do partnership affect equity, access, quality? Now, if you look at all this, I want you to look really at the right side of the slide. So we tell you what fits well. Some of you're thinking about abstract, anything related to public-private partnership fits very well. Anything related to NGO government collaboration, including private sector, fits well. Anything that related to community-based delivery models, governance accountability of multi-sectoral action, all fits very well. Of course, we're not interested in something that I'm describing a project that haven't been implemented because there's no learning that will come up. We are looking for success stories, absolutely, but we wanted to have those success stories analytical, not purely descriptive, because this symposium is looking also at this type of collaboration. Again, this is for subtheme 2. Can we go to subtheme 3, please, Racha? So subtheme 3 is really about the platform participation. This is really talking about digital, social, institutional, all this, what can enable participation, access, accountabilities, and learning. So basically, we're looking at, it's not only technology. We're only looking at who participates, whose voices count, how decisions are being informed, to what extent there is convening power, there's a collective problem-solving approach. How to all this, meaning some of the question, how do digital platforms reshape decision-making service delivery? It's happening as we speak in the region, by the way. It's happening as we speak. How can data and technology advance equity rather than deepen inclusion, exclusion, and harm? We know that there is a huge issue when it comes to data governance, data sharing, how technology really is also being embedded, but also scaled up in an equitable way. What platforms support meaningful citizen and community participation? How can health system governance AI? This is an issue that how we are governing AI, how we're governing data governance, data sharing, digital tools across public, private, and others. And how do platforms build or erode trust, social contact, and public legitimacy? Again, if you look at the right side, what fit digital health governance, AI, a lot of things happening there in our region, service platform, primary care, hospitals, and system integration, data governance, digital well-being, and prevention of digital harm. Of course, what does not fit here is not about pure tech pilot. I mean, you can bring an example of embedded technology now, but you need to actually link it with system implications. So please, whenever you actually submit an abstract, give it a health system spin. Give it really what that implication, give it an analytical spin. This is what will actually catch the attention of the reviewers, because the reviewers will be reviewing your abstract. It's not us, by the way. It's not Racha. It's not me. It's not Goran. It will be scientific reviewers that will be looking at it. But we're giving you tips in this webinar of how you can make your abstract accepted. So you can put about app description, but again, if you don't relate it to how this is governed, what that means to health system, what that means to access, what does mean to information sharing, it might not be of interest to them. So this is let's go to the last subtheme, which is about the pathways and planet. And this is really about the subtheme, situate health system within the broader ecological, environmental, and planetary context. And we've seen a lot of work that's taken place on One Health, on climate change, on others. All this really, allowing a country to rethink about health system performance within the planetary boundaries. What are some of the key questions? How can health system respond to climate change? I know there are a lot of projects, regional projects taking place in our region about climate change. We need to encourage them to submit, because you need also to show the nice thing about this symposium, don't shy away from submission. There's a lot of great work. There's a lot of production of health system policy research in the region, but it's not only about publishing those articles. You need to bring them also to those. This is how you make connection. This is how you bring funding. How you build your network. This is how you get engage in different projects. So don't underestimate the power of the HSR 2026 is not only about presenting and sharing abstract, but it's actually the benefits goes beyond that when it comes to this. So again, how health system respond to climate change? How can sustainability be embedded in system design financing? What governance models support One Health approaches? And how should health system performance be redefined in the context of planetary health? Again, these are some of the questions. What fits well? Of course, climate resilient health system work, environmental sustainable care delivery, One Health governance, all this. What does not fit well, it's not only, you cannot only put environmental study with no health system response or health system implication. So please make sure whatever you submit. Again, I'm repeating myself here, but just to emphasize, you need to bring it about the health system implication and also what that means. Yes, I'm looking at the chat. This is not about the region. It's not about the research in the region. Don't understand. This is actually a webinar that is being done again for this, and such thing is happening across all regions. So all what I'm presenting to you, this is not only peculiar to people submitting abstracts from the region. This is a global thing, but we're giving it emphasis here for the region because it's happening in the region, and there will be later on a pre-conference that will take place as well in the next few months, also about this in the region. But all what I'm talking about here is global. I'm just encouraging you, particularly the people that have joined this webinar from the region. I'm just encouraging you to actually go ahead and engage and submit. Can we go to the next slide, please? You're muted. You're muted.
I think we're done with segment
Fantastic.
part A on the theme and
So,
subtheme.
So do you prefer to open it quickly, maybe 5 minutes, any reaction or question on that, Rasha, or you want to do it that later? What do you prefer?
So we can give 5 minutes, but just to reinforce that, so these sub-themes are not EMR specific. They are the global sub-themes and sub-themes that have been approved by the board
Yeah.
member for everyone from either EMR and beyond. So we can have a 5-minute quick reflection just to
Or
see.
maybe any inquiries or maybe clarification other than the other. Yeah, if not, we can continue, Rasha. But if there's anyone that have a clarification question on the theme, please raise your hand. If not, we can proceed, Rasha, at your end.
Yeah.
It looks like all clear. I don't see any hands. Also, I see some people putting on the chat, but I think this is all good. And of course, we can continue that conversation. So feel free, even after this webinar, if you have any inquiry or questions, send it to us and the secretariat, and we will
Also have a
respond.
space towards the
Yeah.
end for participants to share their ideas. So
Yes.
maybe this is where they can
Sure.
bring in their thoughts and ideas. So
Sure. So Rasha, over to you then.
Okay,
Oh,
so thank you, Fadi, for the excellent overview of the theme and sub-themes. So we will now move into the abstract part B of segment 1, which is the abstract submission tracks. So just to note that the call for abstract was launched in November 2025. And before we move into the different tracks that you can submit abstract, I just want to clarify that the HSR 2026 is not limited to health policy and systems research participants. So anyone whose work engages or affects health system can also submit abstracts. So you can be working in the financial sector, the economic sector, the political sector, but your work has an influence or affects the health system, then you can certainly submit an abstract as well. So if you are a leader, both established and emerging, whether in the field of science, service delivery, diplomacy, governance, design, technology, peace building, commerce, industry, please feel free to share abstract that will help co-create actionable pathways for our shared and independent future health system. And certainly the submissions, as I mentioned, is not only purely research, it can be about implementation and practice, methodological innovation, capacity strengthening, action-oriented learning that contributes or advances to health system transformation in its many dimensions. I will now give it over to Ian from the HSG Secretariat to walk us through the different abstract submission tracks. Ian, just to check, do you have slides that you would like to share from your end, or do you want to use the ones we have?
I do have some slides that I've just received this morning, so I can share I can share my screen with the slides on.
Okay, I will stop sharing.
Yeah.
So,
okay.
So this segment, and Ian, we have roughly 10 minutes max because
Okay.
to move into segment 2.
Let me find. Just trying to share my screen. Sorry, I've not used Zoom for a while. I used Teams, so bear with me. Share screen. There we go. Okay.
Yeah.
Right. So there are 3 different types of sessions. There are.
Ian, just can you do it full screen because we're seeing it as.
Okay.
Yeah.
Okay. Yeah. Is that showing full screen?
Yeah, it's better. Okay.
Great. Okay. Thank you. There are 3 types of sessions that you can submit abstracts for. There's the organized sessions. These have an application deadline of the 30th of January. There's capacity strengthening sessions. Application deadline is the 30th of January again. And then there's the individual sessions. Application deadline is the 13th of March. All information about abstract session types can be found on the HSR website under Submit an Abstract. I'll show you the website in a little. So if I'm going to, this is, I'm just moving out of full screen so that I can show you. So if you go to the HSG website, up in the corner, and there are links throughout the website to this as well, but you can go directly from there to the HSR 2026 website, and on here you can then go to submit an abstract, and that gives you all the details on the different session types, and also has the link through to the themes that have already been covered. Then if you want to submit an abstract, that then you've got a link up there and a link down here, and when you click on that, that takes you through to the submission system. on the submission system, when you click Start a new submission, you're then given your options. You can choose one of the three. If we chose this one, for instance, you are then prompted to fill out some starting details. So you will be required to complete some details there. And if I then add my name, you are then given your primary contact detail fields to fill out. When you complete those, so if we move quickly through that, so I'll just put a test one in here, and then so once you've completed all these details, sorry, then you can save your progress so far. And when you click that, it will then communicate with the back end, and it will send you an email with a code. And the code is this part up here. And also in that email, there'll be a link to take you back to the state that you've got to in your progress of filling out the form. You then progress through the form, and when your form is complete, then you will be able to click the Submit Abstract button, and that will then submit your abstract. And you can carry on editing it until you're happy with it, and keep saving as a draft until you're ready to submit. Once you've submitted, you'll be able to use the same link to view your submission, but you won't be able to edit it anymore once you've submitted it. And then if I go back to here.
Thank you, Ian, for that. Just to clarify that this is really a simple process and it's really straightforward. So it takes maybe less than 5 minutes to complete. And if there are any issues, certainly participants can get back to the Secretariat, but it's really a straightforward form and it takes less than 5 minutes to complete.
Yeah, that's correct. Once the submissions have closed, each of the abstracts will be allocated to 2 or 3 reviewers. There's a diverse panel of reviewers with proven experience. There's a robust conflict of interest process, and each of the reviewers is independent. The abstracts will be reviewed against a comprehensive scoring matrix, and an average score will be calculated from that. And then of those scores, they will be ranked in that order, and successful submissions will be notified by completion of the review process, following the completion of the review process. So it really is simple, and the information can all be found on the HSG website, which I've lost now for a minute. There we go. And the links will take you through to where you can submit the abstract.
Thank you, Ian, for this brief overview. And certainly, if participants have any questions regarding the submission process, we can revert back to you. So,
okay.
If anyone not speaking, if they can mute, please. I think we have one or two of you. Yes, perfect. Thanks.
Okay. So, thank you, Ian.
Thank you.
So just to follow up on where Ian stopped, so we have three main submission tracks, as Ian mentioned, the individual, the organized, and the capacity strengthening track. So the individual is normally the findings from your research project, and so it's normally a 10 to 12 minute oral presentation with 5 minutes allowed for question. If your paper is not accepted as oral presentation, it's automatically transferred to poster or lightning talks. So we added an innovation to the poster in a sense that you will have 3 minutes allocated where each poster presenter will go to the stage and present about their findings in 3 minutes. So it's more of a lightning talk. And we have the multimedia presentation, which can be in the form of short film, documentary, animated film, or photo essay. Then we have the organized session. These can be 60 minutes or 90 minutes, and there are two different types. We have the participatory sessions. This is where you can say you want to do a roundtable discussion, debate, fishbowl, simulation, group modeling, or any other approach that actively encourages audience participation. Or you can have the traditional panel presentation, but it's very important that as an organizer, you must allow time for your audience to discuss and interact, okay? For the capacity strengthening sessions, again, these can be 60 minutes or 90 minutes, and these are typically workshop or training-oriented sessions on diverse topics related to health system strengthening or health policy and systems research. And finally, we have the satellite submission, but unlike the first three sessions, the satellite, it's on a first-come, first basis, and it's a paid session. So this is where a funder or organization would lead these types of sessions, typically by universities, NGOs, or donors, to explore a topic in depth, to run a skill workshop, to launch an initiative. Maybe you have a new Lancet initiative, they would run it as a satellite session, or maybe to convene a dialogue there. So these typically take 60 to 90 minutes, but the individual, organized, and capacity are the ones that are competitive. So you submit, and these are then reviewed by panelists and ranked, and those that score high will be included in our scientific program. Okay. Ian already mentioned about the key date. We just want to emphasize that the organized and capacity strengthening are approaching soon, so January 30. So please, if you want to submit for these tracks, you have to start planning from now. And I just want to mention about the Emerging Voices for Global Health program before we move into segment 2 around the Abstract Development Clinic, because we believe that emerging voices and leaders are the future of health system. They are the one that will be leading the future transformation. That's why we want to shed light on this program. Although it's not part of the official HSR 2026 3-day event, it's linked to it. So it happens 2 weeks prior to the main event, but it targets emerging leaders in the field of health policy and system research, and it takes the form of a blended learning program. So it starts with 4 weeks of virtual learning phase, followed by a 2-week face-to-face phase that takes place in Dubai, 2 weeks prior to the actual 9th Global Symposium. And those emerging voices leads, they will also be able to attend the actual event. So it extends 2 weeks before Dubai, 2 weeks before the actual event, and extends into the symposium. So we have two main tracks. We have the researcher track, which targets emerging researchers involved in health policy and systems researcher. And we have the health system professional track, which targets health professionals, emerging health professionals, activists, policymakers, knowledge brokers, health journalists, or other health system actors. And of course, you cannot apply to both. You have to apply to one. So you might ask me, okay, how can I know if I am an emerging leader? So we did not put the rule, but simply if you have been born on or after January 1986, you are considered an emerging leader. So the application submission deadline is 20 March 2026. And if you want more information, you can contact the Emerging Voices for Global Health Secretariat. So they are independent from our HSG Secretariat, but certainly they are linked, okay? So this is for our students and emerging leaders who are attending this session as well, because I know some of our students are here with us as well. So this is for you. And I have to say that many of the people who graduated from the Emerging Voice program are now pioneers in the field of health policy and systems. Some have also become members of the HSG board. So this is really, it's an innovative program as well for our young and emerging leaders. So before we move into segment 2 on abstract development and support, I want to give the stage to Goran, who is our board treasurer. And Goran will be reflecting or providing testimony about his experience attending both the main event as well as leading the board of the Emerging Voices program. So, Goran, what is your message for the people from the EMR, for those who have not yet attended HSR 2026, as a board member, as a member of the society, as well as a lead of the Emerging Voices? What is your message for the EMR participants? What would you like to convey? So the floor is yours, Goran.
Well, thank you so much, Rasha. Thank you, Fadi. It's so nice to be here, and thank you so much for organizing this fantastic webinar. When I was listening to you, both of you, and also Ian, I wished I could have such a webinar 15 years ago when I started engaging in Health System Global. So yeah, well, before anything else, I am from the region. I am from the Kurdish region in Iraq. I أحكي شوية عربي عراقي. So شكرا جزيلا. Fadi and Russia. It's lovely to be back in the webinar, and hopefully we'll see everybody in Dubai in November. So yes, I started in 2010 in Montreal in the first symposium as part of the Emerging Voices then, and then I've been part of the symposium. So I feel like who I become. But not only me, a lot of my colleagues from Emerging Voices have been part of this exciting opportunity, as Fadi was saying. This is the biggest gathering of health policy and system researchers in the world. And this is not only, as you can see, I'm in scrub, sorry, I'm a physician, I'm a consultant in medicine. So this is not only for researchers, it's also for practitioners. It is for advocates. It's for young people who are aspiring to become leaders in global health or otherwise. It's for philanthropies, NGOs, academic institutions, companies, private sector. So it is a fantastic gathering of all of those people. And you have the opportunity to engage, you have the opportunity to learn, but you also have the opportunity to collaborate and to build long-lasting and lifelong friendships and partnerships and collaborations. Many of the colleagues that I met over these 15 years have become leaders in WHO. We have colleagues who have now become amazing leaders in WHO, for example, fantastic leaders in the World Bank, staff in Bill and Melinda Gates Foundation, working at Africa CDC, working at many philanthropies, professors, prominent professors and thinkers and intellectuals in high prominent universities. So the Emerging Voices in particular provide the platform and the opportunities for colleagues to grow As Racha said, this is not only, it provides you an opportunity to participate in the 3 or 5 day symposium, but it is 2 weeks program prior to the symposium in capacity strengthening activities in ways of presentation, publishing, posters, speaking, participating in many of these platforms. And one amazing thing that we always had, and it's very exciting part of the symposium, is we will have one emerging voice colleague selected by the emerging voices themselves to come and talk in the closing plenary. So you'll be given the stage, a very high prominent stage. So my message, Racha, if I can summarize, is apply. Please get out your work. Do not forget the amazing feedback and instructions that Professor El-Jardali said about being analytical, put a health system and health policy spin on things, look at the intersection of all of these crises and disruptions that are happening around the world, but mainly in our region, and look forward and excite us and open our eyes to things that we probably didn't think about in terms of how we can transform health systems in our region and around the world to meet these disruptions that we are facing on a daily basis. So I hope that was helpful. I put my email address in the chat, so please get in touch. And I also put the Emerging Voices application in the chat as well. So please get in touch if you have any questions. But I think Racha and Fadi and Ian did a fantastic job, and all the best.
Thank you, Goran, for this exciting testimony that you have shared. So I'm sure we all felt the energy and excitement, and we hope you are able to transfer that energy and excitement to our audience and participant, because as you mentioned, it's really a landmark event for our region, and we really hope to see many of you in the main event. And for the emerging leaders or the early career leaders to join the emerging voices, and the more established to join us at the main event. So it's really an amazing opportunity for the region. Thank you, Goran, for your intervention. And I know you are busy, but hopefully you can stay with us towards the end when participants also have questions or want to share ideas they have in terms of abstract. If you would like to stay till the end, then that would be great. If you have to leave earlier, we also understand. So I will move into segment 2 on the abstract development and support. This is where we will provide tips on how to strengthen abstract, as well as share some illustrative framing and diagnostic checklist, which can serve as stress tests to see whether your abstract is HSR 2026 fit. Then we will have around the remaining 25 minutes open for you to share your ideas, your emerging thoughts, whether you have abstract that you would like to submit. So this is where we want you to take the lead. But before that, so let me give you some tips on what makes a strong HSR abstract. So strong abstract, they clearly answer, so what research problem or question you are addressing and why does it matter? So you need to present a problem or question and not just an activity. And more importantly, you need to link it to the HSR 2026 theme. Why does it matter? What is new or insightful about your work? What are you bringing to the table? You don't want to replicate existing work. How does it advance health systems or policy thinking? So oftentimes we come across clinical papers or papers that are too narrow, that they don't give implications for the broader health system or policy thinking. So it's very important for you to have that lens. And of course, why is it relevant beyond one country? Yes, certainly you can submit abstract in your country, but you have to link it to the broader context to offer generalizable insights beyond your country or beyond that institution that you are focusing on, or that healthcare organization you are zooming into. What are the broader implications? This is very important. So common reasons abstract get rejected is because too often they are descriptive. So They are describing a project or a report without providing analysis or learning. There is no systems insight. It's too clinical. It's focusing on a single crisis, a single institution, not linking it to the system, broader system thinking. There is weak methods or unclear data sources. Sometimes the methods and objectives don't align, which raises a flag about the rigor. There is no link to the symposium theme, and sometimes it's overly local. You are focusing on one primary healthcare center. You are focusing on one single crisis with no transferable lessons. So these are some of the reasons why abstracts commonly get rejected. So to strengthen your abstract, these are some of the tips that we will provide to you. So please, before submitting, check that you have a clear research or learning question, including rationale. You don't want your abstract to be just an activity or a descriptive narrative. Check there is an explicit link to at least one of the subtheme or more than one subtheme in some cases. Check your methods are appropriate and align with your objective. Check whether you have a system level contribution lens. This is very important because we're talking about health systems and policy. And make sure you have clear implications for policy, practice, or research, the so what of your findings. What are the implications for policy, research, and practice? How are the learnings transferable to other contexts? Okay, this is important because reviewers typically look for alignment with the theme and subtheme, the level of contribution to health system knowledge, the clarity of the problem and objective, the relevance beyond a single context, and the clear implications for policy and practice, as mentioned earlier. So these are just tips to keep in mind when drafting your abstract. So the second question that comes to mind is, how can you choose the right abstract track? As we showed earlier, there are 3 different tracks that you can submit an abstract to. And I will briefly go over each one. So let's start with the individual sessions. So these are best suited when you have one coherent study, analysis, or experience. So you want to share the findings from a study, analysis, or experience you undertook. Sometimes, even if it's a multi-country study, it can still fit an individual abstract if it's presented as one analysis, one coherent study. So you can have, for example, a study on assessing the COVID-19 pandemic response in Lebanon, or maybe assessing the COVID-19 pandemic response in the Middle East or the EMR, because these are coherent and can be presented as one analysis. You can submit them as an individual abstract. And typically you can have empirical findings or conceptual theoretical, where you present a new framework, a new model around health policy, health system, or any of the sub-themes. Always include the alignment and learning or policy implication in these types of abstract. And in terms of the evaluation criteria, so these are already in the website. So you will be judged based on the relevance to the theme and sub-theme, the scientific technical merit. It has to be rigorous, based on theory, strong, robust, and you have to indicate the significance and contribution to the field of health system and health policy and systems research. Moving to the organized sessions, so these are ideal if you want to bring together multiple perspectives or disciplines around one shared question. So maybe you want to look at the ethical use of AI in health systems. You can bring perspectives from the policymakers, the health professionals, the practitioner, the patient. So bringing these different perspectives around one shared question. Or it can be used, you can submit organized session when you want to compare experiences across countries or actors. So we want to look at the COVID-19 pandemic response across countries of the region or across different actors. This is where organized sessions come in. Or if you want to create a dialogue, debate between your organizers and participants and not just present, this is where an organized session becomes ideal. Of course, a strong organized session should have a unifying question or storyline across the different people involved. You should offer comparative or complementary insights. They should be interactive and well moderated. So In the evaluation criteria, there is strong emphasis on the degree of interaction, to what extent you involve your audience. There is potential for active involvement by the audience. And the moderation, it has to really be well moderated. You should have a clear plan on how you will moderate the whole session, who will be doing what, and certainly it has to include diverse voices. So if you have only researchers in your panel, it will lower your score. So you need to have diverse representation across research, policymaking practitioners. Sometimes you might bring non-health actors. So the more diverse it is, the stronger your abstract. And these are the evaluation criteria. So technical merit, the relevance to the theme, engagement of diverse voices. Yani if at least you need to engage a researcher, policymaker, and practitioner. So at least 2 diverse voices, and certainly potential for active involvement by the audience. And the capacity strengthening is best suited when...
Racha, can I come in just to reinforce what you mentioned
Yes.
about the organized session? I think it's
Yes.
very important. This is it's honestly a great opportunity to bring a group, as Racha mentioned, group of researchers, policymakers, practitioners, or so, that working on a collectively on a project, or and sometimes you might have a project you've already worked on, but you want to also invite policymakers to be part of our organized sessions as well as other stakeholders. So usually those organized sessions are really well received, and we have a great opportunity that you actually put some thoughts about abstract for organized session. If you need data on maybe you're thinking, I received some few suggestions from some people that we know, and they are thinking about organized session. They want an advice. We can, of course, we're not writing it for you, but we can give an advice if exactly what Rasha mentioned. But I tell you again, from my knowledge in the region, there's a lot of great ideas that can be put on organized sessions. And trust me, there's a lot of people that would like to be part of your organized session, whether at the level of speakers, people that can react to what already done, discuss about the implication, etc., etc. So I think there is a great opportunity. We're emphasizing this because we know that the deadline for the organized session and the capacity building session are in January. So you still have time, of course, but wanted to reinforce that please don't shy away from that. It's a great opportunity actually to bring a collective approach to many of the things that you are working on. It could be with your researchers. I sometimes receive some requests to be one of the, an organized session from somebody is putting an abstract from Latin America because they want somebody to actually reflect on a particular element of the work that they are doing. So feel free also to invite people from outside the region to be part of your organization. They would love to. They would love to. It's not only people that you know. It's not only the people that you are working with. So I think it's very important to keep this in mind, and there's a great opportunity actually to be involved at this level. Sorry, Rasha, over to you.
No, thank you, Fadi, for this excellent additional insight. So I agree with you that our organized and capacity strengthening session are the stars of the symposium. So we have lots of demand coming for these types of sessions because they are engaging, they are interactive, they bring diverse perspectives, so they are well attended in general. So moving into the capacity strengthening tracks, so these are best suited when you don't want to present findings. Instead, you want to build skills. So you want to develop skills, or you want to engage in peer learning, perhaps offer methods training on, for example, mixed method review, qualitative review, or application of tools. Sometimes you have an organization that has developed a new tool, for example, on priority setting. They want to pilot test it during the conference. So they can hold a capacity strengthening session to pilot test the tool, or sometimes they publish the tool, then they will hold a capacity strengthening to teach people how to apply the tool. This is quite common. And certainly it's about strengthening individual, institutional, or network capacity. So strong capacity sessions should certainly have clear learning objective. What will I learn from that session? They have to be interactive because you are building capacity. You are engaging directly with people. So they really have to be interactive, hands-on. They have to be feasible. You have to make sure your plan is feasible within the 60 or 90 minutes. They ideally have to address more than one level of capacity strengthening. So we know there are the individual level, the organizational level, and the system or network level. Ideally, you should at least address or hint on how for example, the individual level could also expand or strengthen capacity at the organizational level. And certainly you need to produce concrete takeaway or at least have some tangible input for participants that they can use or take with them. And these are the evaluation criteria which reflect what I just mentioned around the clarity of learning outcome, the format and participant engagement, clear and feasible output, focus on more than one level of capacity. So you can find them on the website as well, these evaluation criteria. So just let me check the chat to see. Is there a limit to the submissions for each individual? So there is no limit, so you can submit as much as you want, but when it comes to the actual acceptance, we typically cannot, we typically don't accept, for example, if Fadi is presenting for the individual abstract and the organized and capacity strengthening, so he can submit for the different ones, but there will be priority in terms of which ones he will eventually be accepted. So we don't normally accept having leads. For example, if you submit 3 different individual abstracts, you will likely have one of them accepted if you are the lead in the 3 of them, because we want to bring diverse participation and diverse voices. So
One thing, Rasha, yes, so basically correct. The one thing I want to mention that even if you had 2 or your 3 accepted, they will tell you later on which one. It doesn't mean that the other one will not be accepted. You might ask one of your colleagues or people that already, part of your research to present on the second paper. So don't feel that, you will be completely discarded with that. It could be 3 or 4, but at least at the main presenter, you'll be one, but the others, you can actually think about who would be maybe the speakers, whatever. This can be taken into consideration. The other thing that if your abstract is accepted, and once accepted, it doesn't mean that you cannot participate on organized sessions, because organized sessions are different. You're coming as a group of people or so. So that's something also to take into consideration. The reason why we want to make sure that the engagement opportunity for everyone when it comes to this. And yes, for the already published paper, I'm just trying to help here, Rasha, with the questions. Yes, it's already that, but it all depends on how you are bringing it to the bear and the abstract. There's nothing wrong when you have a published paper already there. That what type of argument abstract you are really bringing. I'm sure that you're not copy pasting only the abstract from the submission to put it there. It's just you need to make it really. You need to tweak it a little bit to make it fit a little bit more on the abstract submission. Over to you, Rish.
No, thank you, Fadi. So just to reiterate what you said, so it's all about the framing. You might have the right topic and idea, but it's all about how you frame it so that it's HSR 2026 ready. So I know we want to give time for participants to reflect. So I will go quickly over these few remaining slides because already we've talked about these previously. So just to reiterate that if you look to the right, we have a checklist or a stress test to see to what extent your abstract is HSR 2026 ready. So when we're talking about subtheme 1 on politics and polycrisis, these are some of the questions you have to ask. So I'm talking about the box in the right. So does your abstract interrogate power, governance, or political trade-off? Does it treat crisis as structural and overlapping rather than one single isolated episode? Does it engage financing, legitimacy, accountability at the level of health system? Does it move beyond description to system level learning? Does it contribute learning that is relevant beyond one crisis or country? If your abstract meets at least 2 of these questions, then it is HSR 2026 ready. If it doesn't, it means you still have the right topic or idea, but it just needs framing and tweaking so that it is HSR 2026 ready. Similarly, for subtheme 2, this is the checklist. Ask yourself, does my work involve multi-actors or sectors? Does it go beyond describing partnerships to analyzing governance, regulation, or accountability? Does it address commercial or non-state actors? Does it recognize communities or people as agents of change? Does it situate the health system within the wider societal system? If you answer yes to at least 2 of these questions, then your abstract is HSR 2026 ready. If not, then you need to tweak it so that at least it fits 2 of these criteria. Moving to subtheme 3. So how can you know if your abstract is HSR 2026 ready? So you ask yourself, does my work involve data, digital tools, or platform? Does it engage ethics, equity, trust, or accountability? Does it consider participation, inclusion, or exclusion? Does it address data sovereignty, privacy, or trust? Does it link digital platforms to policy or decision making? If you answer yes to at least two of these, then it's HSR 2026 ready. Let's say you answer yes to the first one. So yes, you are working around digital tools, but maybe you haven't introduced a system lens. You are just describing a digital tool. It means you are on the right track, but the framing needs to be enhanced so that it is system ready. This is where you might need to link the digital platform to policy or decision process, or to see how to bring in the governance lens, which is a systems lens. So this is the type of tweaking we're talking about. Moving to the final sub-theme. So these are some of the questions to ask yourself to see if your abstract is HSR 2026 ready. So does my work link health systems to climate or environment? Does it involve cross-sectorial or One Health approaches? Does it focus on sustainability or long-term pathway? Does it move beyond traditional metrics to rethink performance, accountability, or learning system? Does it contribute to thinking about future health systems beyond the SDGs? So if you answer yes to any of these two questions, then you are HSR 2026 ready. If, let's say, you answer yes, your topic is about climate change, but maybe it does not link it to health system, then you are on the right track, but the framing needs to be further tweaked. You need to have a clear implication for health system governance, performance, transformation, etc. So these are just tips to keep in mind to help you guide you with your abstract submission. We will now open the floor for reflection and feedback from participants. So we have already answered some of the questions, and we have received some of your comments, but please feel free to share your ideas and thoughts. So have any one of you prepared any abstracts? Do you have some ideas in mind? Are there some potential opportunities you would like to explore for joint collaboration? This is the time to share your thoughts and ideas with us. As Fadi mentioned, the organize and capacity strengthening timeline is January 30th, so we are giving this a priority. So please feel free to share your ideas and thoughts. And Fadi, myself, and Goran, if Goran is still
I think
here.
Goran left.
Okay.
You had another point, and I just wanted, because there was also a question from Hilda. So thank you, Hilda, for your question about the ranking will be done by the sub team. In fact, the submission will be related to. So basically, all the reviewers, all the abstract will be reviewed equally. Later on, when it comes to what's accepted, not, of course, we want to make sure that we have a balanced type of hopefully submissions and approvals for all the sub-themes to make it balanced across the broader program. But later on, at the level of curation, so we curate later on all the submissions that have been accepted. This is where we actually make sure they fit them all together equally. So don't worry, Hilda, about it. I think you not just now. The most important thing is to make sure it's related to the sub-theme, but it has nothing to do with the sub-theme specific or general abstract. Has nothing to do with the scoring or the ranking. Each one will be, evaluated, ranked completely separately, regardless. So I just wanted to mention that. But that's a very good question. So we're submitting another national level study in KSA on mental health survey. Yeah, I think that definitely, Maha, thank you for your. I think there's a lot of things going on in the Kingdom of Saudi Arabia, and I'm sure there is a lot of stuff when it comes to, particularly when it comes to mental health. But again, as Racha mentioned, really about how you bring in it, how you're framing it, how you're making clear relevance to all the theme and sub-theme. It's not difficult at all. Trust me. I mean, this is how we actually try to relate to all that. So absolutely, this is very much encouraged. Unfortunately, Rasha and I, we don't have, and even Goran don't have the say of what will be approved or not, because we are separate from that process. So just because there is a filter here, there is a separate committee that deal with that. But our role is to make sure that we enable people to actually submit successful abstract. That's what Rasha is trying to do, that how we can really support that process.
So just to build on Maha's point, so this is an excellent example. So you are submitting an analysis from a national level study in KSA on mental health service governance. So this you can actually fit it under subtheme 2 if you focus on the plurality and diverse actors involved when it comes to mental health services at the national level, or if you have a digital component or AI component, you can fit it under subtheme 3. So it's really all about the framing. The topic is correct and relevant, but it's about the framing. And we have a very important question. Can someone from Africa submit an abstract? So I want to re-emphasize what Fadi said. This is not an EMR only conference or symposium. This is an international symposium that is open for all 6 WHO region. Anyone from any place around the world can submit. We are emphasizing the EMR in today's webinar because it will be hosted for the first time in the EMR, but it's an international global event.
And even people from Africa can invite people from the Middle East or people from Latin America or else to be part of their organized session of their work or whatever. That's the nice thing about it. We're doing it only for the EMR, but this is really a global conference. Our colleagues in other regions, they have done the same. They've done webinars and they are encouraging others. So this is really a global event. But I like the question. I think many of those questions, and keep it coming. And now, if not now, but even later, if there's anything specific, I think you have the contact information for the Health System Global Society Secretariat. You have for Russia, you have for Quran, for everyone. I think it would be good to. Rasha, you want to take that, the travel support, because this is a secretariat issue. So this is something that we're not involved as a co-organizers here. But you want to say something about it?
Yeah, so there's no clear answer at this point, but certainly those who submit abstract and whose abstract gets accepted, they can apply for scholarship, but of course the scholarship is limited, so we cannot give scholarship to everyone. There's a limited number of scholarship that can be provided.
It depends on eligibility, but honestly, I've seen many times, all symposium, we have a lot of people coming on scholarship, at least for travel or so, depending on the funding availability. So don't worry about that for now. At least what is important now, because it is to get an abstract accepted. Once this is accepted, things later on will come later on, because it will put you in a better condition later on. Hopefully, if there is funding availability, you will be able to get funding for that. Yes, so it's all about organizing your ideas. Exactly. This is what we're trying to do in this session. It is recorded, so Rasha will be sharing later on, and I think the Secretariat will share it with everyone. It's a recorded session. But again, we don't finish at this conversation today. We are here to hopefully to support you in this process. If you have any questions, any inquiries, with our time availability, hopefully we'll be able to support or answer your questions. So.
Did anyone submit an abstract so far, just out of curiosity?
Still have time. I think this is usually we always do, but hopefully after this time we will have. And again, don't forget the individual abstract later on also, which you have more time to submit as well. So these are the I think the links and the email addresses for the engagement or for any inquiries. You can even send to us directly, no problem. We're here to support as long as we can. That's what I'm trying to say. But this is a very important opportunity for you to engage. I tell you, just to let you know that I don't want to mention name, but last time in Nagasaki, because we have been there every 2 years. Last time it was in Japan. I tell you, I mean, till now, almost a year and something after Nagasaki, there's a lot of things that we have been doing as a follow-up to Nagasaki, whether connecting with the new people, whether putting new proposals with people that we met in Nagasaki, whether we have done a capacity building work from people that we met there. I mean, the sky is the limit of the opportunities you can get from this engagement, and we need really our health policy system researchers in the region to get really engaged at the global level. You guys are doing great work. I'm telling you, I've seen it in most of the countries. I'm a big believer on that. And I've seen the significant work that is really taking place. But sometimes I feel sad that it's not coming, it's not being positioned for such global symposium. I mean, the world can learn a lot from the thing that is taking place in the region as well, as much as we learn from other regions. So that's why, take this as an opportunity, not as a challenge, hopefully we'll actually see you all there.
Okay, great. Then if we don't have any further questions, we can bring it to a closure. So thank you everyone once again for joining this session, and we hope you found it useful and helpful, and we really encourage you to submit your abstract to start thinking about ideas, collaborations within and beyond the region, and hopefully we will see you at the HSR 2026 in November. If you have any questions or clarification, feel free to reach out to us.
One thing, Rasha, I forgot. This is not only for health. I'm sorry, I'm repeating. Not only for researchers, but there is a lot of people working in government, working in ministries, working in the private sector, working in the pharma industry, working in civil society groups. Those are people are eligible to submit. So it's not only for people working in universities. So sorry to just miss that point. I just wanted to reinforce. Thank you. Thanks, everyone.
Thank you, everyone. Have a good day. Bye.